Hello, thanks for stopping by. I'm going to discuss AARP Medicare Supplement Insurance Plans. This is for 2022. It's nice to see you. Thanks for stopping by. Here we go. Good news, a Medicare Supplement Plan helps pay for out-of-pocket costs not paid by Medicare. Today, I want to discuss the relationship between AARP and United Healthcare. I want to talk about choices you have. There are different parts of Medicare and different things you can do to cover what's not covered by original Medicare. Upgrade your Medicare coverage. You want to talk about the different options within a Medicare supplement plan from AARP and how those work. And then I'll discuss how you can select one in particular, one that fits both your needs and budget. So here's the thing. Number one, the relationship between these two iconic brands, AARP and Medicare supplement. United Healthcare is over 50 years, well, nearly 50 years of experience in the Medicare field. AARPs have been serving the needs of people 50 and over, all kinds of need. They're an advocate. What happens is together they offer this solution. United Healthcare provides Medicare supplement plans that AARP makes available or promotes to their constituents. Learn about some choices. Now, here's the thing. There are different parts of Medicare. Let's talk about A and B and C and D and G and F. There you go. There's an alphabet soup. They do. Step one, you get original Medicare from the federal government. Only Part A and Part B come from the government. Part A approximately covers hospitalization. Part B covers outpatient. That is doctors and testing, anything that's done, even an outpatient surgery, anything that's not done in the hospital is Part B. Then one has two different options. You can do option one, which is the traditional approach, get a Medicare supplement to cover things that Part A and B don't cover. And then you add a drug plan as well, because a Medicare supplement doesn't have a drug plan. That's option one. Since around 2000 or so, another alternative, you can get a C. Actually, confusingly, perhaps it combines both Part A and B and potentially has Part D drug plan in it. That's the Advantage plan. So in addition to Medicare, one does either a Medicare supplement plus a drug plan, or one does an Advantage plan. The bulk of this discussion is going to be about this side here, about Medicare supplements and drug plans. A little bit more about what Part A covers. It covers inpatient hospital care. It does cover skilled nursing facility, maybe once you leave the hospital and you spend some time in something where there are nurses on staff. It'll actually cover home health care. If someone needs to go into your home even after you're out of here and they've got to change a wound or something like that, or you need a wound dressed or some kind of care administered in the home, it covers that. Actually, inpatient medical care as well. If someone has to go inpatient for medical care, that's covered. Also has hospice, end of life palliative care, and there's actually some blood transfusion covered. Part B covers outpatient hospital, minor surgeries, anything done not in the hospital, covers physician surgeons when you go to the doctor's office, covers ambulance, and it covers laboratory and testing stuff. It has some blood. It also has some home health care, covers outpatient mental health, medically necessary durable medical equipment like wheelchairs, crutches, that kind of thing, outpatient physical and occupational and speech language therapy, and then some preventative care like shots for flu and pneumonia. Okay, so here's the thing. What does Part A pay for? It pays days 1 through 60, all but 1556. Pays for the days beyond that, all but that, but $300 per day. So in other words, when you go to the hospital, you have a cost share of $1560, and you have a almost $400 a day per pay for that. Goes beyond this thing, it's actually, if you go beyond day 90, it's $778 you got to pay. So these are your out of cost shares even when you have Part A. You have to pay for the first for blood beyond the first 3 pints. And then if you go to skilled nursing, you don't have to pay anything the first 20 days, but after that, you'd have to pay $194 a day. Beyond that, you got to pay for that. So the takeaway is these are things that, despite having Part A, these are things that you got to pay out of cost when you go to hospitalization or if you go to skilled nursing. For medical expenses, outpatient hospital, this is Part B, stuff you're doing not in the hospital. Basically, there's a deductible of $233, and then you pay 20% of that, of the approved amount. So as a general, Part B is going to pay for 80% of what you got going on after you meet the deductible. Upgrading this coverage. So here's the thing. You can do above and beyond Medicare within a Medicare Advantage plan. These supplement plans, there's an alphabet soup, A, B, C, D, and there's a high deductible version of F and G, M and N. We're going to look at those in detail and see how those work, because I've got a nice chart here that shows you what they cover above and beyond what a Medicare covers. Some of the benefits of using Medicare is you can go to any doctor, any specialist, any hospital that accepts Medicare. There's no network component. There's no HMO or PPO applies anymore. Low to no copays. If you get a Medicare plan, potentially depending on which plan you get, you're going to pay very little to nothing at all above them for copays, because it'll cover it. Coverage anywhere, anytime. Your coverage goes when you're traveling anywhere in the U.S., as long as you keep paying your premium. So you don't have to worry about a network or being out of network anywhere in the U.S. you go. You get that covered. Who's eligible for this? Well, if you're enrolled in Part A and Part B, then you can get a Medicare Advantage plan. If you're a resident of the state, you need to have that as well. So you can't apply for coverage in Idaho and not be a resident of Idaho. Are you over 65 or are you under 65 and eligible for Medicare? Disability, for example, or end-stage renal disease, any of those. If you have yes to all this, then you can get a Medicare supplement. MACRA is a particular legislation that came out and basically makes it so people can no longer get on F or C if they are turning 65 after January 1 of 2020. As long as you did before that, then you can still get F and C. You'll see the implication of that in just a little bit. Part D, which is not a part of your Medicare coverage, it's drug coverage. And you can sign up for a Part D plan as well. So you can sign up for Medicare and you can sign up for Medicare Part D. And when you do that, this is the initial enrollment period to do this. When you turn 65, 3 months before or 3 months after. Okay, take charge. Which of these Medicare supplements? We're going to spend a little bit more time. Well, number one, stability. United Healthcare, 1 out of 3 Medicare beneficiaries are enrolled in an AARP plan. On average, that's only been changing 3%, the increase, if you will. And it's the only one endorsed, United Healthcare plan is the only one endorsed by AARP. Finally, here's some service metrics. 94% of the people are satisfied. 98% of the claims are processed within 10 days. And 94% renew those as well. So they're satisfied and renew, and 98% are complain. So these are some high quality metrics when considering AARP. Value. In addition, you do get some gym membership and discounts at no additional costs. You get some competitive rates and discounts. They're backed by 50 years of experience. 9 out of 10 people who have these plans would recommend it. So they are endorsed. Okay, here is the money chart, if you will. These checks show what parts of Medicare, what things that Medicare doesn't cover that these Medicare plans will. So F and C, which are only eligible if you turn 65 before 2020, F was the most thorough one that's available. It has a check, covers all these things except for foreign travel emergency. It'll cover an 80-20 on that. And then actually there's out-of-pocket limits. No, that doesn't apply. So F does all this. C is very similar, but it doesn't do Medicare Part B excess charges. These plans are unavailable. So bottom line is, most people that I enroll in a Part G and a Part N because they are the most thorough coverages that are available. G is the most thorough one of coverage available for somebody who's turning 65. Notice it covers, this is the deductible that Medicare doesn't pay. It covers that one. It covers that one. It covers that one. It covers all these except for the Part B deductible, $230-something. Beyond that, this is going to cover it. So there will be very little out-of-pocket cost during the year for someone who has both Medicare Part A and B and a G plan. We'll have to basically meet the Part B deductible, and then 80%. They'll have to do 20% if they do foreign travel emergency, but locally, really only got to do is meet Part B. Okay, here's kind of comparison of all these things just to kind of see that. It even covers excess charges, which Part C didn't. It doesn't cover the deductible. Part C did. F covers all those things. So these are 3 very similar plans. These 2 are not available anymore for anybody who's just now turning 65. This is kind of considering some of the other plans. These don't cover the Part B deductible nor excess charges. They don't have the travel emergency, except if you do there's a variation of N. For N, the only one that does that. So you can kind of dial in the specific one of these. It'll have lower premiums than Part G and Part G. Okay, here's a couple of sample. This is an example point. This is Florence. She has osteoporosis, broke her leg when she was getting out of the shower. After being hospitalized for several days, she's released to a skilled nursing facility for additional 22 days. During this time, she also had 3 follow-up appointments with the doctor. This is a comparison of what she would pay out of pocket in the different Medicare supplement plans. She had original Medicare only. She'd have to pay the deductible during the hospital stay. Then during her daily, for the 2 days there, she'd pay this twice a day. Oh, at the skilled nursing. At skilled nursing, she'd have to hit this because there were 2 days beyond the first 20. And then there's a deductible on all these, and then there's a co-insurance under Part B. So that scenario, she's spending up $2,200, almost $2,300 for that. If she had a plan versus N versus plan versus G, she'd pay $290 out of pocket. She only paid $230 if she had plan G. So they're 2 different comparisons. Both of them covered the Part A deductible and the skilled nursing facility. They both had the Part B there, but then there's a co-insurance that Part N requires that Part B doesn't. Part G, I should say. Okay. To reiterate, these are the plans that are available if you are over turning 65 anytime after 2020, and these are also available if you turn 65 before January 2020. There are some discounts available. Household discount, if same people will sign up for a plan within them. I'm sorry, if you take and if you do an automatic bank withdrawal, you can save 7% if more than 1 people in the household enrolls, and you can save $24 a year if you pay up front instead of the monthly premium. There are some Renew Active is similar to what some people know as Silver Sneakers. It's a membership and a wellness scenario, and one of the things it results in is a $0 gym membership at a gym membership near you. There's some dental discounts and some vision discounts that also are available with some of these plans. There's a discount associated with hearing. There's a 24-hour nurse line. There's actually a driver safety course added at 0 cost. And then there's this thing about brain health. They've got some benefits on ARP staying sharp. So you get all that stuff in addition to the coverage. These are some disclaimers. One of the things is these discounts are not insurance. They are disclaimers on health and dental. I'm sorry, on dental and vision. Okay, in addition, when you sign up for this, you get AARP membership. So you get the magazine and the bulletin, you get exclusive discounts, health and wellness discounts, travel discounts. So in addition, when you sign up for an AARP supplement, you get that as well. If you have any questions, I'm here to help. Let me know how I can be of assistance. This is my name. These are my phone number. The best way to catch up with me is baseinsurance.com. That's really all I have at this time. Please consider reaching out to me. That's it. Thanks very much.